So what is hernia? Hernia is a defect in the muscle of one's abdomen through which intra-abdominal contents like intestine and fat protrude through that. Now what happens if it protrudes through it? It will go back inside. Yes, most of the time it goes back inside, but the defect slowly keeps on increasing in time, and one period of time a portion of bowel can come outside and it may stay outside without going inside. So this may end up in something called as obstruction because bowel contents will not go ahead. Rarely the blood supply to the intestine which has come out, that can get constricted, and this portion of bowel outside can undergo decay. So these two are emergency life threatening conditions. So how to treat it? Best is to get treated before developing these complications. So these are the most common hernias. These days it can be treated laparoscopically or rarely robotically. We reduce the contents of the hernia into the abdomen, close the defect and place a mesh to reinforce the weakened muscle inside, so that the defect is closed and muscle is also strengthened by it. Now few hernias do not protrude outside, such as hiatal hernia, in which a portion of muscle which separates the chest and abdomen is called as diaphragm. A defect in the diaphragm around the foot pipe is called as hiatus. Through that hiatus, if something is herniating above, it's also a hernia and it is called as hiatal hernia. Now that can be treated by again reducing it. The symptoms will be slightly different. They can present with severe reflux and not able to eat, not feeling appetite, or early satiety, like even after eating a small amount of food one can feel full. So those conditions again can be treated laparoscopically by reducing the contents and closing or narrowing down the muscle. The use of mesh in this condition is slightly rare because the diaphragm muscle itself is a quite sturdy muscle. But if it is weakened and the defect is very big, again we can place a mesh there. Rare conditions like internal hernias are there, in which there is no defect in the muscle, but there is a defect within the abdomen between one portion of intestine or other portion of intestine, through which an outside intestine can come and go inside and get blocked. So these can be treated by identifying it. Identification of it is very difficult. Many of the times cannot be recognized with CT scan also. So for diagnosis itself, we will require a laparoscopy, and if this is diagnosed properly, the intestinal contents are pulled out and the defect is closed, will not require a mesh. So the most common hernias like inguinal hernias and ventral hernias require mesh, whereas other rare forms of hernias like hiatal hernia and internal hernia very rarely or sometimes do not require mesh at all. Now this mesh is usually not harmful. It will get impregnated or integrated with our body tissues. Rarely, 0.01% or 1 in 10,000, this can get infected and may warrant removal of the mesh. But just because of that 1 in 10,000 risk, if someone wants to avoid placing mesh, then there is a risk of getting back the hernia again, or otherwise called as recurrence. So we have to weigh the risk versus benefit. The benefit of placing a mesh when and where it is required is definitely higher than the risk of placing a mesh. So if doctor advises you to undergo a surgery which requires a placement of mesh, most commonly which is hernia, then definitely undergo it without any fear.